Next, we have a lecture by a rare species in this integrated organization. A rare species because he's an allopathic doctor. On top of it, he's an oncologist. And he believes in integrated medicine. So that's why the rare species. Yes, we want Dr. C.P. Ayyappan to come up to give or to explain role of hyperthermia in oncology. And we have Mr. Manikam, whose center has the first hyperthermia machine in India. So let's welcome Dr. Ayyappan, and Mr. Manikam can then speak for 2 minutes. Not more than that.
Thank you. Welcome you all. I would like to thank our beloved chairman of Miracle Integrated Cell Center and the Ozone Forum of India to giving me the opportunity to present the topics in here. It's a hyperthermia. Hippocrates, it's a father of Western medicine. It's a given valid statement. So give me the power to create fever and I shall cure any disease. So let's start with definition of hyperthermia. It's a Greek word to increasing the body temperature on selected tissues in order to achieve the right treatment effect. It's in the range of 39 to 45 degrees Celsius. So a lot of research papers came out showing the high temperature can cause damage and kill cancer cells usually within minimal injury to the normal cells. What is the mechanism behind the hyperthermia? It's a cell damaged cells release the antigen to engulf by the natural kill cells to shrink the tumors. Let's start with history of hyperthermia. It's a start with 2060 BC. So initially, this was carried out in Egypt. The Hippocrates is used heat to treat breast tumors. The first paper of hyperthermia was published in 1866 by a German surgeon called Bibus. The given statement, the temperatures can selectively kill cancer cells while not affecting the healthy ones. American surgeon William B. Cooley introduced the different type of bacterial antigen into the tumors and observed their behavior. And he would be known as the cholestoxin that causes the fever. That fever, it can damage the cancer cells to shrink the tumors. Cooley is the father of modern use of hyperthermia and immunotherapy against cancer. So oncotherm is one of the innovative in hyperthermia. It's a world market leader in local hyperthermia and 30 years experience. The first center in India is Miracle. It's a beloved former CBI director Karthikeyan sir inaugurated on 1 month back. So oncothermia is nothing but a modulated electrical hyperthermia. It's a difference between hyperthermia and oncothermia. The hyperthermia, traditional hyperthermia, it generates the radiant heat. It hits tumor and normal tissues. Compared to oncothermia, it's based on the conductive heating. It's damage only the tumor cells, excluding the normal cells. Hyperthermia at a temperature of 38 degrees Celsius, oncothermia therapy yields better result than classic hyperthermia, which does a temperature of 42 degrees Celsius. The number of cancer killed more than 2.5 times higher. How does the affect the cellular level? So basically, it increases the reactive oxygen species by increased metabolic rate in our body. It directly hits the cell membrane and cytoplasmic protein and nuclear level. It hits by the tumor cells to to produce the apoptosis. Apoptosis is a natural programmed cell death. And at low level, at higher level, it produces the necrosis of tumor cells. So Oncotherm benefits, it's a unique self-focusing physical tumor treatment. It relates on the patient being part of the special low-power radiofrequency circuit. There are several cancer molecular signatures which are targeted. Oncothermia effect cannot be replaced with the sauna or microwave and local heater. It's a basic fungus behind the hyperthermia is heat shock protein. One of the primary function of heat shock protein is to refold the proteins that have been denatured or damaged. Heat shock proteins to play a role in the repair of production of specialized DNA repair proteins that are known to be the mediator of thermotolerance. Good correlation exists between the residual level of heat shock protein 70, 87, 110 and cell survival during the decay of thermotolerance. What is the rationale behind when combining with radiotherapy along with hyperthermia? Usually in cells in late S phase and hypoxic cells are more radio resistant, but we sensitize the tumor cells and S phase by hyperthermia. Hyperthermia can lead to reoxygenation, which improves the radiation response, and also it inhibits the repair of sublethal and potentially lethal damage. And along with hyperthermia, when using the chemotherapy along with hyperthermia, to boost up the chemotherapy response by increased cellular uptake of drug, increased oxygen radical production, increased DNA damage, and inhibition of repair. So delivering the hyperthermia, so modality of hyperthermia is whole body and deep or regional hyperthermia, superficial, interstitial, body or face insertion hyperthermia. This oncothermia is based on the thermal conduction method. Oncothermia is based on classic method of hyperthermia. It's a modulated electrohyperthermia for oncological use, not used as a sole therapy. Typically, it's combined with chemotherapy, radiotherapy, or other therapies. We are along with intravenous medical ozone, high dose vitamin C, and liposomal turmeric. It is typically administered 2 to 3 times a week for 4 to 6 weeks. So whole body hyperthermia, it's a technique to heat whole body either up to 41 to 40 degrees Celsius. It's called as extreme whole body hyperthermia. It's a 39.5 to 41 degrees Celsius for longer period, especially 3 hours. It's called as moderate whole body hyperthermia. In carcinoma with distant metastasis, steady state of maximum temperature reaching up to 42 degrees Celsius can be maintained for 1 hour with acceptable adverse effect. It's usually used for metastatic disease. It's intended for activation of drugs and enhancement immunologic response. What are the evidence behind the oncothermia along with other modalities like radiotherapy or chemotherapy? This trial is focused on locally advanced pelvic tumors. Hyperthermia prescribed once weekly during the period of external radiotherapy, 1 to 4 hours after radiotherapy, to the total of 5 treatment. The response rate for cervical cancer, the complete response rate with RT plus hyperthermia was 83% compared with 57% after radiation alone. The survival was persistently better after 12 years, 20% for RT and 37% RT plus hyperthermia. P-value was significant. The performance status is only decided by how much do you integrate the hyperthermia along with radiotherapy. Hyperthermia did significantly and add a radiation-induced toxicity compared with RT alone. Other trials focused on locally advanced cervix cancer. 6 randomized studies include. The conclude was superior local control tumor attained and overall survival also can be improved. Chemoradiation with hyperthermia in head and neck cancer. So conclude was demonstrate the feasibility and efficacy of concurrent chemoradiation with hyperthermia in advanced head and neck cancer. The overall survival was 75.69% at 1 year, 63.08 at 2 years. Another trial is focused on advanced breast cancer. This also is a boost of the response rate of chemotherapy and radiotherapy. Overall response rate is RT alone is 41%, 59% for radiotherapy along with hyperthermia. This pancreatic cancer, hepatocellular carcinoma and cholangiocarcinoma is survival rate is very poor, less than 3 months, either is treat or not. But you are incorporating hyperthermia along with chemotherapy, the survival was gradually improved more than 10 months to 12 months. Patient is having, if a patient having ascites formation, the response rate is comes down either add to hyperthermia along with chemotherapy. First we let out the ascites to add the hyperthermia along with chemotherapy. This is cholangiocarcinoma. If we adding the chemotherapy along with oncothermia total 10 times, the tumor mass is drastically reduced. This is breast cancer with the liver mets. The tumor mass was is more huge in liver. And after treatment with hyperthermia, the tumor size is reduced. It come back with another modality like radiofrequency ablation or intra-arterial chemoembolization or radioembolization. This is brain mets with the breast cancer patients. Before oncothermia and after oncothermia, the size tumor was drastically reduced. The cerebral edema was disappeared. This is glioblastoma. It's a glioblastoma, I think it's a grade 4 glioma. It's a tumor mass drastically reduced after oncothermia. Rectal carcinoma is more notorious to the patients. Either you're treating either radiotherapy or chemotherapy. When combined with hyperthermia, it's a patient getting more good response rate and along with surgical cure rate. This is a Prosperity randomized clinical trial. This is a locally advanced cervical cancer patient, 2 to 3 cervical is, the graph is drastically separated at 2 years. The p-value was significant. This is a randomized trial is focused on breast cancer. The response to neoadjuvant therapy with the cisplatin is the BRCA positive breast cancer patients. When patient is combined with heat induced by hyperthermia, the BRCA is achieved. Once BRCA is achieved, you combine with platinum based chemotherapy to get the complete pathological response compared to wild type BRCA with the triple negative patients. This is another case of locally advanced rectal cancer. The conclusion was the patient is less radiation dose combined with hyperthermia, and another arm is standard care. You have to reduce the radiation dose by along with hyperthermia. This is, you start with radiotherapy, now move to chemotherapy. Now era of targeted therapy with chemotherapy. You boost up with oncotherapy with concomitant moderate electric hyperthermia, you get your best result. It's coming forth. This is a summary. The treatment is fully recognized by International Clinical Hyperthermia Society. The moderate hyperthermia in oncology refers to the process of heating a tumor with the range of 39 to 42 degrees Celsius in order to ensure the tumor to oncologic treatment. The National Cancer Institute of America said hyperthermia is a non-invasive treatment which can help shrink cancer tumors. It is especially helpful as a complementary therapy to chemotherapy and radiotherapy. So oncothermia is a description nano heating technology. Oncothermia will take over where the other classical hyperthermia methods are unable to manage the brain malignancy, head and neck malignancy, and extended liver, lung, breast and GI malignancy. So modulated electrical hyperthermia is a safe form of hyperthermia which has shown to be effectively sensitive to tumors regardless of thickness of adipose layers. We conclude, ladies and gentlemen, oncothermia has become the fourth modality of gold standard in the armamentarium of cancer therapy. Thanks for listening.
So Pollachi rocks. Huh?
Thanks everyone. In fact, what we are doing with the hypothermia thing is, normally in Europe, they're using it along with radiation and chemotherapy. And maximum dosage of vitamin C they give is 7.5 grams. I think they're regulated not to give more than 7.5 grams. We are giving 70 grams along with hypothermia. So along with the hypothermia, we are giving concurrent dosage of vitamin C. And we are seeing fantastic results, much better than what they got in Europe. So we are seeing disintegration of tumors. and very good results. In fact, even the Hungarian people are quite happy with what we are seeing. And hopefully we will be able to set a new standard in this. We are asking for 3 treatments a week, alternate days, 4 to 6 weeks, depends upon the tumor. Other days we do ozone, vitamin C and everything else, and of course every day we give them zinc, so we combine everything. Yeah.
And I request Dr. Karthikeyan, Dr. Emilia, you can come and felicitate the team. Yes, the first machine. Oh, not small anymore. Please come.